Okay, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. Right out of the gate, we can see that the biceps tendon's torn here. You can see the fraying in it. We're going to pass a stitch through it just to secure it provisionally. So that's a spinal needle you see coming through. Then we'll take a metal wire called a super shuttle. We'll pass that through. We'll need a grasper in the gray cannula here in just a second here up front. Grasper in the gray. And so there you can see the wire coming through. This is called the shuttle relay. Gotcha. And you'll see why in a minute. I can grab this wire. Then my helper can pull out the needle straight out all the way. And then I can pull the wire and load it with a stitch. So in just a second, if you keep looking there, hold the camera right there, you'll see a suture come through. Just like that, see? And now we're going to do the same thing one more time. So we'll take the spinal needle again and do the same thing one more time in a slightly different area. So see how we come from a slightly different angle? We'll come through here. Careful there. We'll take the relay and pass it through. This time we're going to pass, hold the camera there for me, see on the screen. We're going to pass a bunch of the relay through this time. There it is. We'll keep going here because this time we have a little trick that makes this a stronger stitch. There's the hole. That's what we put the stitch in. And we'll take the grasper. We'll back the needle out. And now here's the trick. We're going to come around behind the biceps. See how we do that? That's the trick. I know it's underwhelming, but for us it's exciting as shoulder docs. And so now we're going to go ahead and load that suture into the relay a second time. And the reason we go around behind the biceps will become obvious here in a second. Okay, so now we've got that suture coming through. We'll show you some more in just a minute. Okay, so now we're going to take a pair of scissors and cut the biceps here. And now that's released, so that can't cause any more problems inside the joint. And now we're going to go, here you go. Now we're going to go ahead and have a look around the joint. Okay, here we are looking at the glenoid down below. I don't see much arthritis there. The humeral head looks pretty good too. Some wear and tear changes, but nothing out of the ordinary. No areas of full thickness cartilage loss here. Hold the shaver again. And now we're going to rotate up and look at the rotator cuff, which we know is not normal. Here's the tear. This is where the rotator cuff should be attached, and it's not. So from this view, we can clean off the insertion that we're going to be reattaching the tendon down to. Hit the pump pressure up about 10, just for a minute. Yeah, like 60, 50 or 60 for now. Okay. And so this just allows us to clean off the area where we have to put the tendon back. You can see it right there. This is the torn edge of the tendon right here. Okay, so we'll show you some more in just a minute. Okay, so this is the tear in the tendon. As you look down at the bottom of the screen here, you can see it. This hole right here is what we're talking about. And I'm just cleaning up the edges of the tendon right now with my shaver. We can see it's at about the level of the articular cartilage there. And then posteriors to the left side of the screen. I'm going to put the shaver in the front. Just take it around the front there. Okay. So here the shaver's coming in the front now, and we can work on the back part of the tear right here. So we can see that tear extends all the way back. See, it goes back much farther than it would first appear. Okay, so we're going to go ahead and get to work now. We're going to place a suture anchor down. I'll show you some more in a minute. Okay, so we use this needle to plan our repair. Hold the camera here very still. As we rotate internally, we can see we want to get our first anchor down way back here. The second anchor is going to have to come way up here. We maybe want a little bit steeper angle, so something like that might be a little bit better. I like that. We'll take a little scalpel, make a little nick in the skin. And we have a guide that comes in here. There it is there. We place that guide exactly where we want the anchor to go. Let me have you take that, and let me have you come in here and internally rotate for me. Just like that. Okay, and then Gareth. Okay, so now we've got you internally rotated, and I can see where the tear stops right about there. So I'm going to place my first anchor right about here. Pull it. Stay right there. Nobody move. Okay, so we take that down into the bone. We'll pull back. You can let go of the arm. And that gives us 3 sutures to work with. We're going to seat the anchor by pulling back on it. And that's very solid. You can see if I hold the camera still, I can pull the entire humeral head with those 3 sutures. So we're going to reach in from the front with a crochet hook and take out one of the sutures here. We're going to use a straight crescent suture hook first. And as we pick a suture here, I think we'll go ahead and pick this one first. That's going to go inside that clear cannula. We take a grasper. Grasper in there. Straight crescent to me. Let it turn to the right on the other handle. So here's our hook. Okay, Gareth, you're on the camera. Hold real still here. And then with we're going to pull all these other sutures out of the way. And now I want to reach up underneath here and make sure we get the full thickness of this tendon. We can see it's in a couple parts. And we want all of it to be repaired. So we especially want to get this deep layer. I'm going to pull back so I can show you a little bit better. Yeah, so there I've got a good hold of the deep layer. Let me do it again. Pull back on this, pull back on that, yeah. Okay, great. Okay, hold it right there. Okay, we're recording. Hold right here. And you can see me come through right there. That's what I wanted to do. Make sure I get all the way underneath. And so, come back to the right. Just, yeah, perfect. We'll go ahead and retrieve this. And then we're going to do something that we showed you a little bit before. We're going to load that black wire with that blue and white suture right there. Okay, we'll pull back. There it goes. And it's going to come out right here. Okay? That looks great. So we're going to get the partner blue and white suture. This is why they're color-coded. So I want to make sure I get this without any intervening suture. So that looks good. So we'll go ahead and tie this knot right here just to secure this posterior aspect. Okay, so now we're going to use this hook, which has a little bit more of a curve. It's a 45-degree curve to the right. The first stitch that we just tied is right here. You can see it Knot's right there, back there somewhere. And now we're going to take this hook and pass another stitch. It's already getting hard to see because we've already started to repair it, but I like the way that's looking so far. Hold the camera there. Hold that for a second. Just put a hand on. Okay, let's see. So we're going to reach in here, and again, I'm always checking to make sure that I'm getting that deep layer. If I'm not, I need to readjust my technique. So that looks good. Hold the camera right there. And there we are, coming underneath. That looks good. Pull back just a little bit, just a hair. Yeah, great. And now we've got that passed. Okay, so we've got a second anchor in. We're going to take a crochet hook, and we're going to start working with the sutures from the second anchor. You can see we've passed the other two sutures. We haven't tied them yet, but they're all passed. They just haven't been tied from the first anchor. So we'll take this, if we can keep our convention here, we'll take the blue and white striped one first, just like that. We may not have room to use all three of these sutures, but we'll use as many as we can. We'll go ahead and take our turn to the right hook and a grasper in the front. Other way. Yeah, and so here's the turn to the right hook. You can see our other sutures coming through. So we're going to place this one up in this region here. Hold the camera there, please. There's the hole that we still have to deal with. And I think we'll take this down right about here. I think just about there. We'll show you some more in just a minute. Turn to the right. Turn to the right. Okay, we're continuing to make good progress here. Now we're going to move next in line. We're going to go right about here. The last stitch we did, you can see it right there. So now we're going to place another one right about here. Hold the camera right there. There's a good pass. Pause. What are you doing? Okay, so now we've got all the sutures that we've passed but not tied coming out to the right. We've got the very first one that we tied there, but now we're going to start tying the rest of these and get this fixed for you. So we'll take this black and white striped one. That's the next one in line. We're going to tie that knot. Then we're going to tie the blue one. Then we got blue and white. Then we got black and white. Then we got solid blue again. So we got our work cut out for us. We'll come back up on the video when that's done. Shaver. Okay, so we're all done here. We've got all the sutures tied. We've got nice overlap and coverage with the two anchors that we placed. We have a total of 6 sutures. We did use all 6 sutures. The biceps tendon sutures have been tied and secured. And here you can see all the way to the front. So I'm going to slowly turn down the pump pressure in a minute, but right now we'll leave it on. Let me show you as you rotate your arm how it looks. So that's all moving together as a unit now. That looks good. We're going to go ahead and take a little punch and make a couple little holes in the bone here just to try and stimulate a healing response. We always leave a little space laterally to do that. But the actual repair there looks really good. Okay, so, yeah, perfect. So just a couple holes. Actually, with the size tear we have, maybe just two. One, Okay, that's one hole. We call these our bone marrow vents. Okay. And the bone marrow elements, proteins, growth factors, cytokines, and cells will come out of those vents. You can see it if you look carefully as we turn down the pressure. You'll see these areas start to flow. There you go. So there you can see it looks like little droplets. Those are all coming out of the marrow space. So that's going to help in the healing response. So good luck to you now. We're going to finish up here in just a few minutes. Bye-bye.